When it comes to integrated safety planning for both domestic violence, other kinds of violence, and substance use, what are
Mhm.
some things that are helpful for advocates to be aware of, for them to be thinking about and talking about with survivors as they support them in this integrated safety planning?
I think it's important for advocates to really understand the the system view and how perpetrators of domestic violence use substances to further control and abuse their victims. And if they're in the system, the dependency system, the family law system, the criminal system, any of them, that really gives the abuser some power in that area too, if he can manipulate that piece of the survivor's experience. But I think it's really important for us to know how the system looks at these issues and how they might approach it with a survivor, how what kind of judgments. I think we spend time looking at, we know that these certain systems are going to feel very judgmental to the survivor, whether they mean to be or not. It how can we kind of counter some of that and help them one see the system is going to look at the issue this way, doesn't mean it's right, doesn't mean it's fair. It's just the fact that's the way it's going to be viewed. So what can we help them do to, move into the view that they want to be seen in? What kind of challenges may they face and what kind of barriers will they have to focus on overcoming? And then at the same time, we're also kind of behind closed doors and so to speak with those partners pointing out how these things may feel judgmental and how a better approach to this particular family may be more successful. If we try to get to know the survivor in a way that I can say, if you come at her like that, this is the response that you're going to get. But if, we present this in this way, it may feel better for the family. They may be more apt to engage and try to help both sides to manage that. And I think it's important that we understand it and understand that I personally see this, as an illness in a sense. I think about it in respect to other, if somebody was diabetic, I wouldn't blame them for that. If they had cancer, I wouldn't blame them for that, or the things that happen or the way they may have behaved as a result of something like that. So I think we kind of have to look at it that way, and we try to internally. So we try to teach that a little bit and try to help, I guess, some of those judgments by looking at it from a little different lens than maybe they're used to. For instance, I know with a child welfare system, it's a lot more prevalent, but if a person is using, a lot of times they're just viewed as not a good parent. And I don't think you can make that kind of assumption just based on one thing, so being able to help them pull back and look at that in comparison to something that we wouldn't be judgmental about or blame a parent for sometimes can help. So I think as advocates, we have to work on being able to do that and maybe manage those conversations between partners and survivors in a way that we can understand the other perspectives, but also for the survivor, not carry the load. The judgments that they may feel aren't necessarily on them. That's the person doing the judging, the judgment's there. So help them not carry that with them through this process.
Yeah, so a real survivor-centered approach and looking at all the different ways the substance use is used to exert power and control over them
Mhm.
by a partner who is seeking to, an intimate partner who's seeking to exert power and control over them and harm them. Also, how all these systems might view substance use and then advocating within those systems. And as you said, that an abusive partner can really continue their abuse through these different systems.
Right.